Greetings, I am here to talk about the hope that all children with autism and cerebral palsy have. But right now, you may be asking yourself, who is this guy, and why is this important? Well, I'm a high school student that participated in an internship called the Cerebral program, which stands for Science Education Partnership Award. This internship allowed me to work with a professor from UCSD for 6 weeks during my summer break. The importance of this subject was while I was doing this internship, I had to work with children that had these disorders, like this child shown right here. They were so lively and carefree, except that their lives were being pinned down by medication and the lack of physical movement. As I worked with them, I wish I could help, but I couldn't because these disorders targeted the brain, one of the most complex organs in the human body. But hope came in the form of the professor I was working under, Dr. Doris Trauner. She gave me the idea of researching hyperbaric oxygen chamber therapy on children with autism and cerebral palsy. The idea seemed perfect since I wasn't interested in the medical field, but the engineering field. I was excited and went on to learning more about hyperbaric oxygen chamber therapy and how it helps children with autism and cerebral palsy. HBOT has been used throughout the ages, from the 60s to the present, as a device for medical procedures. HBOT works by placing twice the amount of pressure on the patient. Then it releases 100% pure oxygen. The pressure should be administered since this allows the oxygen to be more compact so it can easily move through spaces that are hard to reach and that are blocked by blood clots in the vein and in the brain. Hyperbaric oxygen chambers have been used to heal wounds at a faster rate than normal, since the skin cells grow faster now that 100% pure oxygen is being placed in the body. It cures divers that have the bend. A buildup of nitrogen bubbles in the bloodstream that can throw off the heart's rhythm and cause the heart to stop because of a heart attack. It helps patients that have suffered a stroke. A stroke is caused by the block of blood to the brain, but since the oxygen from the machine can pass blood clots, the brain can get the amount of oxygen it needs before parts of the brain start to diminish, and has been used on patients with cardiac problems, such as people with high cholesterol that have suffered a heart attack. It has also been studied that HBOT can pump oxygen throughout the body while the heart is motionless. But how does a session of hyperbaric oxygen chamber therapy help children with autism and cerebral palsy? Both disorders have been characterized as a genetic disorder, but nothing of oxygen has ever been in place. But other evidence shows that oxidative stress in the brain causes this disorder to form. Oxidative stress is caused when parts of the brain have been deprived of oxygen by environmental factors, such as smoking and air pollution, and the brain can't repair the damage the lack of oxygen has caused. But since HBOT can pass through these obstacles by being absorbed through the skin faster, oxidative stress becomes reduced. Also, HBOT is harmless since it's only pumping 100% pure oxygen. But most models, as seen here, can only fit one adult, since most of the time they'll just be napping. But since this deals with children that can be very hard to handle, we must comfort them and keep them entertained. Luckily, a child can fit in with another adult, so both the parent and the child can fit in the chamber so that the child is comforted during the long hour session. And since it's just 100% pure oxygen in the body and twice as much the gravitational pressure, the adult is fine and there's no side effects. Now, children show reduced signs of autism because of this treatment. Since autism is a disorder that affects the child's brain, many children don't develop speech very well. Also, their movements become limited, and they become antisocial. Many don't talk, or try to make new friends during school, because they like to keep to themselves a lot. But because HBOT reduces these signs, the child develops much better social skills and gain control of their movements better, and they also become much more fluent in the language they speak. Also, children with cerebral palsy show signs of improvement. If a child has cerebral palsy, half or all their body becomes paralyzed, as shown by this image here. They lack speaking skills and motor skills, and because of the motor skills, they lack muscle. But HBOT changes all of this, as they gain better control of their movement and learn more if they didn't take the therapy. This is a great catch for any child, except there are some downfalls to HBOT. First off, it's really expensive, as an hour session can cost $400, and to have dramatic results, a child has to keep on coming back for about 1 month and keep on taking the same session every single day for 3 hours. Also, because twice the pressure builds up while you're in the chamber, your eardrums start to pop, causing discomfort and loss of balance, but you can regain that really quickly. Finally, it's not a great idea to take a session on a full stomach, as the pressure can cause the patient to vomit in the chamber. But all in all, if the parent's rich and the child can survive these few pains, then virtually there's no side effects. This all sounds great, and it actually works, since many medical procedures had to go through clinical research. I also studied clinical research during my internship, and it turned out to be very fascinating. Clinical research has to do with 4 steps so that a new drug and a new method of medical practices can be used on the patient. The first phase is non-human testing, such as the simulation and testing on a computer, and sometimes animal testing. Phase 2 tests a small group of human volunteers. No clinical research can be done on people that don't want to be tested on. This phase tests if the product can be fatal to humans or not. Phase 3 has an even larger group volunteering, and it tests out if the benefits outweigh the cost in this drug or medical procedure. The fourth and final phase is the approval by the FDA. Then the drug is sent to local pharmacies, but the tests are still not over. The FDA keeps a close eye on the product to make sure the product benefits the entire society. If the drug does what it's supposed to do, then the FDA leaves it alone until an even better drug becomes approved by the FDA. Well, that is all the information. Please do the post-test in the email sent to you, along with the emailing of the pre-test. Thank you for listening, and I hope you will like to change the future of the medical field, because then the whole entire world will be a better place.